Hi everyone. Today I'm going to be talking about Learning Outcome 6, discuss the potential effects of radiation and chemical pollutants on later development. This one was pretty interesting just because in most of my kinesiology courses I've just been learning about how our external environment does play a factor in how our internal physiological processes occur. Um, I'll start off with radiation exposure. Um, the first trimester is really the most critical period um, because of the formation of organs. Exposure to high doses of radiation during this time can lead to growth retardation, central nervous system abnormalities, and intellectual disabilities. Um, in some severe cases, it can even result in microcephaly or even pregnancy loss. Later on in pregnancy, exposure may not cause structural um, malformations, but it can still impair brain development and lower IQ scores in the long run, which plays a huge role in motor development, motor skill development, cognitive development. Medical professionals are pretty aware and cautious with diagnosing um, like issues during pregnancy. Um, Protective lead shielding is used to minimize fetal exposure to high doses of radiation. Once a child has been born, being exposed to high levels of radiation um, prenatal when they were still in the womb can increase risks of childhood cancers such as leukemia, which can also further impact motor development and overall health. Um, Now moving on to chemical pollutants, um, often silent but detrimentally harmful. Examples include lead, mercury, PCBs, pesticides, and air pollutants. Um, for example, lead exposure can cross the placenta and accumulate in the tissues, inside the fetal's tissue, causing neurological deficits, delayed motor milestones, and reduced attention spans. Attention span. Um, Big takeaway is that chemical pollutants and radiation interfere with normal development and the milestones that we have gathered, and their effects last way beyond birth. We'll see it later on in their lifetime in their cognitive and physiological processes.